PO2 normal during day, sleep apnea, central CSA, brain function, obstructive OSA, obesity, BMI more than 30, hypoventilation, PaCO2 high during the day and night, PaCO2 high during the day and night, Pickwickian syndrome, respiratory failure, type 1 hypoxemic PO2, in ILD, interstitial lung disease, pulmonary edema, decreased PO2, type 1 hypoxemic, type 2 is hypercapnic, respiratory to OSA, CSA and COPD, type 3 is a perioperative, type 3 is a perioperative, and type 4 is a shock with a hypoperfusion, type 4 is a shock with a hypoperfusion, type 4 is a shock with hypoperfusion, usual interstitial pneumonitis, honeycombing, idiopathic pulmonary fibrosis, fibroblastic foci, temporal spatial heterogenic, drug of choice, pirfenidone, anti-TGF beta, nintedanib, anti-PDGF, and pirfenidone, anti-TGF beta, nintedanib, anti-PDGF, temporal spatial heterogeneity, fibroblastic foci, idiopathic pulmonary fibrosis, IV, visual interstitial pneumonitis, UAP, fibrosis, sepsis, pancreatitis, and toxin. Diagnostic criteria for diabetes, modified criteria, diagnostic criteria for AID, severity of disease. PO2 5, open FI to less than 300, married to control to 300, modern under report to less than 100, check everything, clinical insult of new or worsening respiratory symptoms. Within 1 week of clinical insult or new or worsening respiratory symptoms, chest radiograph, bilateral capacity is consistent with pulmonary edema, not fully explained by effusion, lobar, lung collapse or nodules, absence of left arterial hypertension, normal pulmonary capillary wedge pressure, normal. Goals and limits: tidal volume less than equal to 6 mmol per kg, BW blood to pressure less than equal to 30 centimeters, H2 respiratory rate less than 35 bpm, FiO2 less than equal to 0.6, SpO2 88 to 95%, decrease P prevents initiate varying pressure, limited ventilation, oxygenate, minimize acidosis, diuresis, MAP more than equal to 65 mmHg, avoid hypoperfusion, pH more than equal to 7.30, respiratory rate less than equal to 35 ppm, increase to around SCM, increase with prevents collapse, SpO2 88 to 95, FiO2 less than equal to 0.6, cardiogenic PE, pulmonary edema, early sign, interlocular septal deafening, pleural effusion, early sign, interlocular septal deafening, pleural effusion, veteran sign, cardiomegaly, veteran sign, pulmonary edema, non-cardiogenic pulmonary edema, biological physical consolidation, no pleural effusion, no caudal line, no cardiomegaly, no pleural effusion, no Curly line, no cardiomegaly, cardiogenic pulmonary edema, Curly line, interlocular septal deafening, pleural effusion, prone ventilation, exudated proliferative nephritic edema, hyaline membrane, interstitial inflammation, fibrosis, edema, 0 hyaline membrane, 7 interstitial inflammation, 14 fibrosis, 28 is pleural effusion, light criteria for pleural effusion, light criteria to modified Berlin's criteria, okay. 14 pleural serum less than 0.5, transudate and exudate to more than 0.5. Airdays pleural serum less than 0.6, more than 0.6, pleural radius less than equal to 2/3 of per millimeter, normal serum radius, pleural radius more than 2/3 of per millimeter, normal serum radius. Cirrhosis CHF and nephrotic syndrome causes cirrhosis CHF, nephrotic syndrome, pneumonia, TB and malignancy. Cirrhosis CHF, nephrotic syndrome, pneumonia, TB and malignancy, low glucose REM, rheumatoid arthritis, empyema and malignancy, REM, rheumatoid arthritis, empyema and malignancy, high MRS, pancreatitis, esophageal rupture and malignancies, pancreatitis, esophageal rupture and malignancies. Indication of transitory effusion, split, pleural skin, glucose, pH less than 7.2, gram stain, culture present, and loculation. Gram stain culture positive, loculation, split, pleural skin, decreased glucose, pH less than 7.2, drainage of effusion, split, pleural sign, decreased glucose, pH less than 7.2, gram stain culture present, loculation, visual rupture and malignancy. High MI pancreatitis is a visual rupture and malignancy. Low glucose rheumatoid arthritis empyema and malignancy. Low glucose rheumatoid arthritis empyema and low glucose rheumatoid arthritis empyema and malignancy. Chylothorax lymphatic leaks triglyceride within more than equal to 110 mg per deciliter fluid. Chylothorax lymphatic leaks triglycerides within more than 110 mg per deciliter of the fluid. Pseudochylothorax normal triglycerides cholesterol crystals seen in the rheumatoid arthritis. Normal triglyceride cholesterol crystals seen in the rheumatoid arthritis. Pseudochylothorax normal triglycerides cholesterol crystals seen in rheumatoid arthritis. Chylothorax lymphatic leaks triglycerides within 110 mg per deciliter of fluid. Chylothorax lymphatic leaks and pseudochylothorax normal triglyceride cholesterol crystals seen in rheumatoid arthritis. Pulmonary embolism clinical probability inflict all clinical prediction rules low, intermediate or pulmonary embolism. Unlikely reason for higher pulmonary likely more than full CTPA. D-dimer most sensitive test for pulmonary embolism. Below cutoff resistance P excluded now below cutoff. Adjusted CTPA investigation of choice. Negative positive P excluded P confirmed pulmonary embolism excluded pulmonary embolism confirmed negative and positive CTPA. Treatment algorithm unstable pulmonarity. Contraindication embolectomy stable low molecular weight equivalent. Contraindication IVC filter inferior vena cava filter. High clinical likelihood of pulmonary embolism P. If point source X is 4. Clinical variable Wells score signs and symptoms of DVT 3. Alternative diagnosis less likely than pulmonary embolism is a 3. Heart rate more than 101.5. Mobilization more than 1.5. PU DVT 1.5. Hemoptysis 1. Cancer 1. Prince's child DVT hypercoagulity status endothelial injury hypercoagulity status and stasis and endothelial injury suprarenal IVC McConnell sign RV strain McConnell sign akinesis hypokinesis hypokinesis RV atypical wall hyperkinesis RV free wall akinesis hypokinesis LV RA McConnell sign RV strain on ECG. Most common sinus tachycardia, most specific S1 Q3 T3 sign, X-ray specific sign, McConnell sign, RV strain, RV apical wall hyperkinesis, RV free wall akinesis hypokinesis LV RA McConnell sign, RV strain 1 on ECG. Most common sinus tachycardia, most specific S1 Q3 T3 sign, X-ray specific sign, water Westermark oligemia, Hampton's hump and paras prominent pulmonary artery suprarenal IVC on ECG. Most common sinus tachycardia, most S1 Q3 T3 sign specific X-ray specific signs water Westermark oligemia, Hampton's hump, paras prominent pulmonary artery. Akinesis hypokinesis RV free wall akinesis hypokinesis RV apical wall hyperkinesis LVRA PAH group description Dana-Poyni classification idiopathic hereditary BMPR2 associated with connective tissue disease, HIV infection, portal hypertension, congenital heart disease, schistosomiasis, clinical hemolytic anemia. Dana-Poyni classification idiopathic hereditary BMPR2 associated with connective tissue disease, HIV infection, portal hypertension, congenital heart disease, schistosomiasis, chronic hypolytic anemia, PAH into left heart disease, PAH into lung disease, indoor hypoxia, crest, most common chronic thromboembolic pulmonary hypertension, plexiform arteriopathy, PH with unclear multifactorial mechanism, pulmonary hypertension with unclear multifactorial mechanism. First line DOD considered diuretics, oxygen anticoagulation, digoxin Acute vasoreactivity testing done via right-sided heart catheterization done via right-sided heart catheterization. Acute vasoreactivity testing. Oral CCB congestive cardiac blocker. Oral consumption blocker. Oxygen anticoagulation. ORS no higher PD5 oral tracheostomy. Oral pulmonary artery hypertension and oral inhaled ileoprotein had VSS considered early combo therapy. Higher risk hypoprostenol or treprostinil considered early combination era or PD5 inhibitor oral atrial septostomy and post-shunt lung transplant. Side effect heterodoxy. Busentan, macitentan, and ambrisentan, macitentan, and busentan. Tassylafil, no with nitrates. Guanylate, cyclase positive, Riosigot. Jug handle appearance. Owing to left heart disease, pH owing to the lung disease and or hypoxia, chronic thromboembolic pulmonary hypertension, plexibone, arteriopathy, PA with unclear multifactorial mechanism, PA with unclear multifactorial mechanism, PA with unclear multifactorial mechanism. Chronic thromboembolic pulmonary hypertension, plexiform arteriopathy, PH owing to the lung disease and or hypoxia, Christmas common chest infection, most common typical CAP, streptococcus pneumonia, most common cause of the atypical community acquired pneumonia is a mycoplasma, most common cause of hospital acquired pneumonia, more than 40% negative. For the early streptococcus pneumoniae, that is Pseudomonas and Acinetobacter. Curve 65 scoring syndrome confusion 1. Urea, hydrogen, 1. Respiratory rate more than 36 to less than 60 dash BP less than equal to 61. Age more than equal to 65. Curve confusion urea, respiratory rate and systolic BP dash to BP. 1111 OP old amoxicillin plus or minus 0 to 1 P2 fluoroquinolones by Bl plus erythritol doxy amoxicillin plus or minus macrolide doxycycline FQ Bl plus erythritol doxy plus FQ plus erythritol OP is 0 IP 122 ICU 324 no amoxicillin macrolide doxycycline FQ Bl erythritol doxy Bl FQ erythritol primary criteria 1 to 6 suggestive plus 7 definite episodic bronchial obstruction peripheral erosion of area positive immediate skin test to aspergillus positive precipitating test to aspergillus increased total serum Ig transit of fixed lung infiltration proximal bronchiectasis secondary supportive criteria brown plug flexion sputum positive less 6 to 12 hours Art skin test to aspergillus hand in glove appearance allergic bronchopulmonary aspergillosis hand in glove appearance allergic bronchopulmonary aspergillosis allergic bronchopulmonary aspergillosis episodic bronchial obstruction, peripheral erosion of area positive immediate skin test to aspergillus, positive precipitation test to aspergillus, increased total serum Ig, increased transient of fixed lung infiltrated proximal bronchiectasis, secondary criteria is a brown plug flaxen sput. Positive late 6 to large skin test to aspergillus, increase monad sign aspergillum fungal ball. Treatment is symptomatic. Hello sign invasive aspergillosis. Invasive aspergillosis immunocompromised neutropenia management. charcoal leading crystal, galactine 10, charcoal leading crystal, galactine 10, Crayola bodies sloughed of epithelium crushed spirals interleukin 4 inhibitors dupilumab. 13 is a tralokinumab and lebrikizumab. Benralizumab, interleukin 5 is a mepolizumab, Th2 cell avoidance, glucocorticoids, fluticasone, budesonide, fluticasone, budesonide, glucocorticoids, mast cell degradation, leukotrienes, histamine, interleukins, allergen specific IgE, exposure to allergen dust pollen, allergen specific IgE. Allergen is geophyrin, PD4 inhibitors, roughly will last COPD only. Adenosine inhibitor, muscarinic antagonist, tiotropium, acute response, bronchoconstriction, chronic response, inflammation, pro-inflammatory cytokines, phospholipase inhibitor, glucocorticoids, fluticasone, fluticasone, બંને ઇન્હિબિટ કરશે. પછી 5-lipoproteins, anti-leukotrienes, ilutin, anti-leukotrienes, motilocastines, sulfuricast, activation of histone, theophylline like lipolysis, bronchodilation, inhibition of phosphodiesterase, and increase cyclic AMP level due to decreased cyclic AMP hydrolysis, limited use of neurotherapeutic index, cardiotoxicity, neurotoxicity. Cytochrome P450 blocks the action of adenosine, arrhythmia, PD inhibitor, decrease inflammation, and bronchodilators. Step 1 to symptoms less than 5 days per week, low dose ICS and formoterol needed. Night time, LD ICS, formoterol daily. 4. Lower lung function, moderate dose ICS and formoterol. LAMA plus high dose ICS plus anti-IgE interleukin 5. COPD gold criteria, gold AB should test spirometry, assessment of the airflow obstruction, assessment of the symptoms, service cocktail exacerbation. Okay, post cardio bronchodilator FEV and FS is less than 0.7 grade, FEV 1% is gold and more than 90-50% and 30% history more than 2 moderate exacerbation, more than 1 leading to hospitalization, or 1 moderate exacerbation not leading to hospitalization. LABA plus ICS, SABA, SAMA, LABA, LAMA. MMRCO 0 to 1 get less than 10 and MMRCO more than equal to 2 get more than equal to 10. Symptoms, central lobular, smokers, Apple Watch, pan-lobular, low, alpha-1 antitrypsin deficiency, alpha-1 antitrypsin, anti-lobe is affected, pan-lobular, low, alpha-1 antitrypsin deficiency, paraceptal, most common smoker, paraceptal, most common smokers, paraceptal, pan-lobular, low, alpha-1 antitrypsin deficiency, pan-lobular, low, alpha-1 antitrypsin deficiency, and paraceptal, most common in the smokers and central lobular smokers and most common central lobular smokers and lobular index, mucus gland open cartilage, chronic bronchitis, occupational lung disease, all occurs in the upper lobe except asbestosis, all occurs in the upper lobe except asbestosis, cell calcification, silicosis, progressive massive fibrosis, cell calcification, silicosis, cell calcification, progressive massive fibrosis, progressive massive fibrosis, Kaplan syndrome, CWP+, Erasmus syndrome, CWP+, systemic sclerosis, Kohlberger, CWP, pneumoconiosis, anthracosis, asbestosis, calcified pleural plaques, holy leaf sign, calcified pleural plaques, holy leaf sign. it's a fibrosis, polylepsin, asbestosis, serpentine, crystalloid, amphibole, crocidolite, dumbbell-shaped crocidolites, and bell-shaped. Leche fibrosis, polylepsin, leche fibrosis. Most common complication adenocarcinoma of the lung, most specific mesothelioma, hallmark frozen hemothorax, mesothelioma, adenocarcinoma of the lung, most common complication, most specific mesothelioma, hallmark frozen hemithorax, microscopic short stubby microvilli, long slender microvilli, adenocarcinoma, mesothelioma, nephrine. Cobalt, diamond industry, giant cell, interstitial pneumonitis, berylliosis, biliary dental alloy, granulomatosis, mimic sarcoidosis, BLBT, beryllium, lymphoproliferative test screening, HLA-DP, carcinoma, squamous cell carcinoma, small cell carcinoma, smoker, yes, small cell, yes, location, central genes, P53, AMIC, HP, keratin pulse, azopardi effect, salt and pepper chromatin appearance. And keratin pulse, P40, P56, synaptophysin, chromogranin, neuron specific knowledge, bombensin, SIDS, Cushing's disease, idiums, increased calcium, parathyroid release and peptide, increased calcium, parathyroid release, PRP, parathyroid release and peptide, synaptophysin, chromogranin, neuron specific knowledge, bombensin, SIDS, Cushing's disease, LEMS, inhibit peripheral EGFR, ALK, KRAS, lipid spread, TTF1, greater than absent, gynecomastia, large cell carcinoma, Trousers syndrome, thrombophlebitis, hypertrophic pulmonary osteoatrophy, clubbing, and merantic endocarditis. Pancreatioma, small cell carcinoma, organization twice, congenital pulmonary malformation, congenital pulmonary malformation, hyperlucent left upper ear, congenital lobar overinflammation, hyperinflammation, congenital lobar overinflammation, sequestration, systemic aortic arterial supply, extralobar, intralobar, own visceral pleura, chest pleura with parent lobe, systemic venous drainage, pulmonary venous drainage, foregut complications, CDs associated accumulation represented perinatal infancy, adolescent, congenital pulmonary airway malformation, congenital pulmonary airway malformation, congenital pulmonary airway malformation, aortic arterial supply, congenital pulmonary airway malformation, congenital lobar overinflation, hyperlucent left upper lateral, integrated rheumatoid genital biductal birth, autoantibodies, ANA more sensitive for SLE, entry criteria titer more than 1 gem 80, NTC1Q greater than 92%, DNA positive, that disease activate a flare, anti-stone, drug-induced leukocytic drugs, drug-induced leukocytic drugs, NTSM, more specific for SLE, anti-neuronal antibody, anti-glutamate receptor 2, CNS lupus, anti-ribosomal P, psychiatric manifestations of SLE, anti-U1, RNP, mixed connective tissue disorder, assist organ disease, congenital heart block, neonatal lupus, anti-LSSB, Sjogren's anti-Jovan, anti-synthetic syndrome, anti-ME2, MI2, dermatomyositis, leukocytosis, anti-trophomonas, diffuse scleroderma, mechanic hands, anti-synthetic syndrome, mechanic hands, anti-central limited scleroderma, crest, P-inca, perinuclear myeloperoxidase, microscopic polyangiitis, Sturge syndrome, hemolytic colitis, C-inca, cytoplasmic villus granulomatosis, GPA, proteinase 3, RFIgM against FC, part of the IgG anti-endothelial antibody. Kawasaki's disease, anti-applying knowledge antibody-based disease, anti-applying knowledge antibody-based disease. Kawasaki disease, anti-endothelial cell antibody. Kawasaki's disease, anti-applying knowledge antibody-based disease, anti-tubercular DNA, anti-histone. Speckled homogeneous mixed remaining over nuclear syndrome here. Speckled homogeneous anti-tubercular anti-histone mixed nuclear is anti-trophoisomerase SS anti-scleroderma syndrome here. Crest and peripheral. Coarse speckled negative, coarse speckled homologous, fine speckled, coarse speckled nucleolus syndrome here. Cytoplasmic staining of the C and perimeter staining P and Nuclear ACR criteria for classification of PCD diagnosis: ANA positive and a score more than 10, anti-nuclear antibody positive and a score more than 10, constitution domain fever, cutaneous domain, non-scarring alopecia or subcutaneous or discoid was acute cutaneous paper 6, Jacoidus synovitis tendency naturally 2 branches and 1 erosive 6, neurologic domain delirium psychosis 0 2 3 5, serocytic domain plural of pericardial effusion acute pericarditis 5 and 6, hematologic domain leukoplakia thrombocytopenia autoimmune hemolysis IgG warm type direct home state 3 4 4, renal domain proteinuria more than 0.5 gram per 24 hours, class 2 or class 4, 5 lupus nephritis, class 3 or class 4, lupus nephritis 4, 8 and 10. Logical domains, anti-phospholic antibody domain 2, complement protein domain 3 and 4, logic, highly specific antibody domain, anti-DS antibody, anti-SM antibody 6, IgG, IgM, C3, 1Q, full house effect of lupus nephritis, viral loop lesions, false positive ADR and RPR anti-cardiac antibody, prolonged PTT that is not corrected by the addition of normal platelet-free plasma, lupus antibody, maximum minimum steroid plus mycophenolate mofetil cyclophosphamide, histopathologic classification of the lupus nephritis. Class 1, Class 2, minimal mesangial lupus nephritis, deposit of immune complex is detectable during hemoglobin technique. Light microscope. Less than 50%. Hallmark. Manifestation include active lesions, chronic inactive lesions, or active and chronic lesions. Diffuse lupus. Focal lupus, diffuse lupus, inactive diffuse segmental lobe endopapillary 50%, more than 50%. Class 5, membranous lupus nephritis. Sclerosis, sarcoidosis.